I really wanted to create a space that is healing because the other thing is I think when we're asking people to do deeper healing, we need to be in like a out of flight or flight, right? We need to be able to like drop in and drop deeply. And the spaces we practice in medicine don't actually support that very well, right? Our clinic rooms and tables and just the spaces have trauma associated with them often from especially for people who have been in and out of clinics or cancer centers or the hospital. Like there is a trauma response to walking in the door of the cancer center. And so I wanted to create a space where people could be supported by the environment and really be able to drop down into a different space. And I want it to be over time. Like this is a journey over months to longer as we sort of wind our way through what is healing and how do we create a life that helps you meet your needs and helps you feel good.
Hello, everyone. Welcome back to the channel, or welcome to the channel if you're new here. I'm delighted to have with us today Dr. Sonny Miles. She is board certified physician in internal medicine, hospice and palliative care, and integrative medicine, and she is the founder of Healing with Intention. And I'm flabbergasted at the amount of healing she's done in her own life and how she is sharing that with people today. So I can't wait for her to tell you a little bit more about her. So before we dive in, Sunny, welcome to the channel.
Thank you so much for having me. I'm so excited for our conversation.
Me too. And for both me and the audience who hasn't had the opportunity to hear your story, can you share a little bit more about you and what brought you to where you're at today?
What brought me to where I am today? That's a long story, but try to make it short. I grew up in sort of the world of alternative and complementary medicine. My mom owned a natural skincare company, and I sort of got brought into the trade shows and sort of learning about all of these other ways of healing before I ever really learned about conventional medicine. And when I was in high school, my mom went back and did a master's of traditional Chinese medicine and acupuncture. And so, again, my exposure was this whole other, much broader world of healing with, people like Andrew Weil's books and Dr. Mel Madrona, who's a physician who also does Native American medicine and brings those together. So I was really, as a teenager, really curious about the capacity of the body to heal. And then, I did undergrad at MIT, obviously very sciencey,
Yep.
very
Yep.
research based,
Mhm.
and I loved it. And I loved learning about the body. And my degree is actually in brain and cognitive sciences. So sort of learning about how the pathways and the anatomy and the circuits and all of those things. But when I left, I wasn't really sure where I wanted to go because I really wanted to do healing, but I didn't really know what that looked like. And so I escaped to the other side of the world and was a Peace Corps volunteer in Paraguay and got to like integrate some of what I had done and got to be exposed to a whole different world. And I learned, sort of folk medicine was part of everyday life. Like we, walked around and picked plants up to drink in mate and tereré. And when people were sick, they would like make a tea. And so this understanding of like the healing power of the natural world was everywhere. It wasn't like siloed to like a single medicine person. There was like a baseline level of knowledge. And then there were spiritual healers and there was a very broken medical system. And so getting to see sort of what was both lacking and what was really beautiful made me really want to do made me want to get the best education in healing that I thought that I could. And I thought that was medicine. And so I became a physician. But in that path, as you know, you sort of get, I hate the word brainwash, but you get indoctrinated in this narrow window of what medicine is and what healing is and what's acceptable. And I did it for a while and I was a hospitalist, but once I started practicing, it was like, my soul was like, there's more, right? Like I would patch people up and they would leave and then they would come back and then I would patch them up and they would leave and then they would come back.
Yes.
And it just didn't feel like I was really making an impact on people's lives in any meaningful way. And so that's when I started I did the Integrative Medicine Fellowship with Andrew Weil's center and started to like re-engage with all the things that had fueled me before. So that's where I got started, and I did hospice and palliative medicine. When I was looking to transition meaningfully between jobs, I found a shamanic healer who's really just taught me a lot about what it means to move through the world. And I did some training with Dr. Lissa Rankin, who's an author and who uses, different internal family systems to talk about medicine and parts and how we heal. So just have gotten to have this amazing journey with different people and through different ways of healing and trying to make those my own.
I really love how you expanded your horizons to see which resonates, what doesn't, what are the like areas of weaknesses and strengths in each of the different modalities that you've been able to really investigate. And when it comes to medicine and what you said there, I think part of it's also the culture of this quick fix culture that we've created in at least the
Yeah.
United States of expecting people to come. I remember even on a mission trip, they said, you just, make sure you're giving them something, whether it's a vitamin or something, so that there's this belief that you've done something. It's like, no, I want to counsel them and support them with developing the tools, because with a lot of the mission trips, you come and you go, but you're not leaving people with sustainable types of practices to help with healing. And you just captured it so well. And a lot of the issues that we're seeing in Western medicine is we are doing a quick fix, but without getting to the underlying issues, and especially the things that I think are under discussed, which I would love to hear from you what you notice those to be in, traditional medicine.
I really think that one problem is the disempowerment in traditional medicine. So again, it's like this very hierarchical relationship where the doctor or the healer has the power, and we're sort of telling someone how to heal. We give them a prescription, or we give them a diet, or we give them something. And I think real healing comes from me as an individual being empowered to listen to my body and say like, okay, you're suggesting that, and that feels right. I'm going to try that and see how my body responds or how I feel. Or, no, that actually doesn't sound like the right kind of diet for me. So I think I think one of the problems is the way that we approach it, like the power dynamic. And certainly it needs to be there needs to be respect both ways, right? I think what we're seeing now is like the power dynamic is lessening, perhaps at least on the side of patients feeling like the doctor doesn't have as much power, but it's not a respectful relationship always both ways. And so I think it's really like honoring the patient's expertise as well as the healer's expertise, and coming to a place in the middle where both people feel like it's a place to move forward. And I think the other piece that you're talking about is that healing takes time. It really isn't a quick fix. It takes time, and it takes energy, and it takes commitment, and it's not linear, right? Like you do something for a while and it works, and then all of a sudden you're sort of at a plateau and you need to change and to shift and to move. So that's the other piece, is it's truly a healing journey. It's not just someone giving you the prescription and saying it'll all be better.
Mhm. And it seems like even that empowerment, when viewing that picture and that partnership, is supporting that individual in their leveraging their own healing capacity.
Yeah, yeah.
And I think about, even just as physicians, thinking physicians as patients, and thinking about how much the physicians also need healing, and then thinking about tuning into the body. I'm just like in my brain, like how much of our training is that disconnecting from our body, such that if you ask a physician or most patients to really tune into their body, they're like either avoidant or just so disconnected. How may we support people in becoming more in tune with their body?
I think we have to go there first, right? I don't think we can teach people what we haven't done, or the work. If we haven't done our own work, we can't take someone else on that journey. Um, and so and to me, my what I've been saying is that it's our lives that are the biggest medicine, right? And so when we're in work, take training because it's an easy one. When you're working 80, 100 hours a week and you're trying to cram all of this knowledge in your brain and you're trying to make everyone else happy and you are depriving yourself of sleep, you are not going to the bathroom until you can't stand it or until there's an opening in your day and you're not eating or you're eating caffeine and sugar which is what I did at night to
Mhm.
like get you through the night, right?
Likewise. Yeah,
Um,
totally.
you can't actually be embodied to teach someone else how to be embodied. And so I think it's first as healers, we have to begin to do the work. And I was listening to a podcast with Dr. Becky and a guest, and it was like sometimes the self-practice just begins with like drinking a cup of water in the morning, right? Like that simple, I don't know where to start because it's a big undertaking embodiment. And so I'm going to start by hydrating myself or giving myself something that I need. And I think then beginning with that question, like, what do I actually need? Because often our head tells us all the things that we need, but it's not what our body's actually telling us. And so learning to asking the question, what do I need? And learning to distinguish like where that answer is coming from. Is that like my heart and my soul, or is that just my head saying the to-do list, or that I should eat healthy, or that I should exercise? Like, where's the answer coming from?
That resonates so much. So I in medical school and in residency, I struggled a lot with anorexia. I was completely disconnected. And the way that I was able to do the harm to my body was because I was so disconnected. And I still struggle with that today, but I'm more in tune. And I also find what your example was there of just drinking water. It's important, I think, for people to do those small steps and to find success because the amount of trauma people have gone through if they like start to jump into their body, it might be
Yeah,
too much. So I really appreciate that example you gave as something like start small, start something that you can be successful at that's not going to be flooding and you start to trust yourself, something such as thirst.
yeah, yeah, yeah. There's so much in our bodies, and I think that I think the real underneath problem is self-love and self-worth,
Mhm.
right? That so many of us are disconnected for that, or so many of us, especially as women and women physicians, believe, at least on some level, that our worth is connected to our productivity or to how we show up in the world. And when we start to learn to love and honor ourselves, then we can take care of ourselves, right? But for so many of us, it's like I have to take care of everyone else before I can take care of me. And that's exactly what medicine taught us, right? And training teaches us is like ignore yourself, push yourself beyond a rational point, beyond sleep, beyond hunger, beyond where you can function all the time well, and take care of everyone else. Like they are more important than you, and your worth is because you take care of other people. And so there's a lot of undoing and unlearning and unraveling. And I really think the crux of so many of the ways that we live in the world is that we don't fully love and trust in our own worthiness.
Mhm. And how were you able to start reclaiming the narrative and developing sort of an inherent self-worth and self-love?
It's a work in progress. I will
Mhm.
say that. I'm
Yeah.
aware of it, and that's a huge piece.
Mhm.
I have done a ton of therapy. I have done a lot of coaching. I've done a lot of journeying and hypnotherapy and all sorts of things, right? Like again, my own healing journey is that I've sort of found different people along the way that help me with different things. And so but I would say coaching and therapy and journeying helps me connect to me in a different level. Right now I'm doing a mastermind with Dr. Amanda Hanson, who's a clinical psychologist that calls herself the Midlife Muse. And it's all archetype based and it's really delving into these questions. So I feel like I'm even more aware, but I'm making more progress, every sort of layer of the onion of peeling back like what are the self-limiting beliefs? What are the things I've been taught that I believed that are actually not helpful for me?
Mhm. and I'm on this journey with you alongside. And I found something that you talk about on your website is grief.
Yeah.
And I found part of this journey is hard and is painful because we grieve or we feel kind of like it's a little confrontation of all these beliefs that have caused us pain for so long that actually are not even grounded in our best interests. They were never meant to be things that helped us rise. I'm curious if you felt that, or kind of what are the emotions that you've been processing through as you're reclaiming these narratives?
I think there's so much grief, and I think as a society we don't model grief, we don't talk about grief. And even when we do, we talk about death grief primarily, and there's so much more grief than just the loss of someone. Um, loss of relationships, loss of your identity. Even I was talking with a friend about becoming a mother, right? Like there's joy in that, but there's also the grief of losing who you were before you had kids that we don't talk about as much. You're supposed to be joyful.
Yep.
And I had this thought that in some ways medicine is the best thing that ever happened to me, and in some ways it's the worst. And it's that the worst part is what you're talking about, that the ways that I learned to be safe in medical training, to get through medical training, were also really harmful to me as a person. And they served a purpose within a period of time in my life, but we don't learn to let go of them, and then we carry them forward, and then we're trying to like make a life that feels meaningful and joyful, and yet we have these ways that we're still treating ourselves or still functioning that don't actually allow that next step to happen. And so that's where some of the unlearning is. And I have so much grief around the ways that especially my relationship with my physical body and my appearance. Like I have a lot of struggles with my body, and so there's so much grief of like this adversarial relationship with my body that it didn't deserve, right? But it's just what I learned growing up in the 80s and my family, and what a body is supposed to look like, and mine, at least in my mind, didn't look that way and doesn't look that way. And so yeah, there's um a lot of grief around all the ways that I wasn't kind to myself for many years. And I think it's really important. We have the tendency to then beat ourselves up
Yeah.
for that. And it's really about grieving it and understanding that we do the best we can, right? We're evolving, we're growing, and all we can do is move forward. So it's not about beating myself up for what I did or didn't do, but trying to, grieve that younger me and hold her, right? Like that's internal family systems. A big part of it is the attunement with these younger parts that are in pain and trying to show up for them differently now.
Yeah, thank you for sharing that. I think it will resonate for a lot of women that are listening to this, and I'm not sure the men's perspective when it comes like it's very fascinating that you bring this up. For me, I've really suppressed the feminine aspects of myself. I started as a military surgical resident, and I felt like I fell into line with more of the masculine aspects of who I was because women in society are oppressed. And as I'm like psychologically analyzing it, I think that it is like this oppression through the objective nature of you need to look in a certain way and be smaller and like be quiet, and your body is some object that is to be judged. And medicine perpetuates it with weight stigma. And it was very loud to me when I was a resident and struggling with anorexia. Well, it wasn't clear until a couple of years into my struggle, and it was frustrating because I'm like, without the weight stigma, I could have gotten help a lot before. Like I was on my near deathbed from anorexia, and I see that some of the belief systems that we have were created from this really oppressive paradigm and the diet culture that often capitalizes off of people's insecurities. And this year, I was really feeling shameful because I was diagnosed with cervical dysplasia and I've been abstinent. This is like TMI, but I'm going to share it because hell, you're here, you're, this kind spirit soul, and I think it's time for this to come out. But I was abstinent for over 10 years because of objectification and trauma to now just a couple of weeks ago, I had a leap for severe cervical dysplasia and the amount of grief I had because they said, well, that infection, the HPV probably was able to do that because I was so malnourished. So my immune system was compromised. And it was like this like complex emotions of really wanting to be with myself with compassion, but that self-critic, that shame, that judgment, and it's like all coming out at once. So I think that balancing of what you said, you leaning into the IFS, and it really sounded like coming and being with that younger self, that part of yourself with this compassion is so important. And I can't imagine if we're not, if we haven't developed any aspect of that, how rampant that self-critic and that shaming voice could have been.
Yeah, the shame is really loud, especially in medicine. And I feel like I tried to be invisible in medical training, right? Like I tried to be as small as possible and not be called out. And the way the other thing I've been reflecting on is the way that we're taught to compete against each other in medical training is really harmful in beyond, right? And what some people call like the sisterhood wound of women harming other women. And I can see how that was set up and how I watched that happen even in medical school when you're in rotations competing against each other for specific, honors or whatever. And so I feel like that shame voice can be so loud and it's so painful. And I don't, my guess is it doesn't go away. You just learn to recognize it for what it is so that so that it doesn't harm you. Like you can still feel it, but it's trying to take away its power when it's like telling you how wrong you are or how you shouldn't have done that or how embarrassing that was. And you just say, oh, I'm feeling the shame and coming back to we're doing the best we can.
Yeah, and if you were to go back to yourself in medical school and residency and for the people who are there now, what would be a healing way to be with ourselves then and kind of to reclaim the narrative on how we're supposed to act?
I wish that I would have not bought into the needing to be a certain way. I wish I could have had more more trust that I was enough and that my way of being was enough and that I brought beautiful things even if I brought different things in other people, right? And I feel like one of for me, being interested in integrative medicine from very young, right? Like it had to be secret because it's so frowned upon in the general, Western medical culture. And so it's like this whole part of me that was like I could pursue it in acceptable ways. Like I ran an elective for integrative medicine and we did a conference for integrative medicine, but I couldn't embody what I really loved and what really lit me up fully. Even as an attending, right? I did palliative oncology here in Northern Colorado for a while and I did some integrative medicine consults, but you still have to stay within these very narrow lines and really like I want to be who I am. I want to bring all of it together. I want to be the messy. I want to be the winding path. I want to talk about energy medicine and plants and all the things that resonate with whoever I'm working with, right? Like I don't want to have to stay in this little container that's integrative medicine or that's palliative care. Like I bring all of these things and I really wish that I had been able to feel that I was enough through medical training, that I didn't have to try so hard.
It's interesting. I hear a lot of people always give this disclaimer of I'm not woo or they're really afraid to speak about things that do land outside of traditional medicine. What are some of the misconceptions that you've palpated when it comes to what integrative medicine actually is?
It is such a widely used term and it has so many different meanings. To me, it really means using the whole toolbox. And with the sort of disclaimer that there are things that I would think are harmful, right, out there that I would not, that are not my medicine. And so I really think it's, for me, it's using the best of Western medicine, um, with whatever else in the toolbox resonates with someone, right? I one time was going to the acupuncturist and she's like working on my adrenals via acupuncture. And then I was doing a session with my shamanic teacher who's also sort of energetically working on my adrenals. And they both came to the same place to work separately. It wasn't something I said, oh, I need you to work on this, but it was just that understanding that there's a lot of different ways to approach the same problem. And that's where I think the patient or person empowerment is, right? Like, I like acupuncture, it works for my body. I like energy medicine. I'm less into um, other things. And so for me, it's like really picking the things that speak to me, that feel intuitively like there's something I want to try. So and the other piece I would say about integrative medicine is it's really under the relationship matters, right? Like the patient and my relationship matters, and healing happens within the container of that relationship. Whereas it's not, I still do some palliative care work in the hospital, and I just was reflecting on how much time I actually spend apologizing to patients for how the system works because all of the doctors are constantly rotating, right? We all work, so many of us work on schedules where it's like the hospitalist is on for so many days or the palliative care doctor is on for so many days, and then it's a different doctor. And the surgeon was here for the weekend, but there's a different one during the week. And patients, it's really hard, and I'm not, the system is the way it is for reasons, right? None of us want to work 7 days a week or can be healthy working all the time. But it's also very hard for that relationship and the healing part of that relationship to develop because we're, at least in the inpatient setting, it's very disjointed often.
Mhm. First of all, thank you for sharing all of that. And even the words integrative medicine, right? It's integrative. It's not absence of conventional.
Yes.
It's integrative. And I worked with the integrative medicine team for research when I was working with at MD Anderson and had the opportunity to pull some data when they were doing some research with patients who were inpatient and just seeing how challenging it was to provide yoga therapy for patients who are inpatient because they're often getting pulled, getting disrupted, they can't sleep, and having just that human conversation and some sort of peace when they're in a system that otherwise can feel quite sterile and they can feel unseen and unheard. I think that is so important,
Yeah.
and it's challenged, you're right, with the
Yeah.
way that the system works, and it's understandable. And
Mhm.
well, I mean, I'd love for you to share kind of what you've created to support people when we know aspects of the system make it really challenging to get integrative medicine.
Yeah, I created my own small practice here in Northern Colorado to do integrative medicine, especially for people with serious or chronic illness. So again, I think that living with illness is challenging and we can do it better, right? What I talk about is we're working on both your diagnosis, whatever it is, but on your relationship with your diagnosis, because so much of the suffering actually comes from our relationship with what's going on with our bodies, right? And that's where some of the grief a lot comes up of like, my body doesn't work like it used to, or I can't do the things, or I don't have as much energy as I want, or I have this diagnosis that feels like I should have been able to avoid, and that the shaming voice of like, what if, what if I had done something differently? Maybe I wouldn't have this illness now. And so I really wanted to create a space that is healing, because the other thing is I think when we're asking people to do deeper healing, we need to be in like a out of flight or flight, right? We need to be able to like drop in and drop deeply. And the spaces we practice in medicine don't actually support that very well, right? Our clinic rooms and um, tables and just the spaces have trauma associated with them often, from especially for people who have been in and out of clinics or cancer centers or the hospital. Like there is a trauma response to walking in the door of the cancer center. And so I wanted to create a space where people could be supported by the environment and really be able to drop down into a different space. And I want it to be over time. Like this is a journey over months to longer as we sort of wind our way through what is healing and how do we create a life that helps you meet your needs and helps you feel good. Whether your body heals completely or not, there is healing that's available to make life better with whatever you're living with.
That's so beautiful and so important to really recognize that people have like PTSD reactions. Even you hear the scan anxiety or scan anxiety, and that physical reaction, they may have some aversion to that space that they were in for treatment or the first time they received their diagnosis. I really value what your vision has been, is to create a sacred healing space for these individuals.
Yeah. It's actually one of the benefits of telemedicine in our current system too. Like one of the patients that taught me that was like, I don't want to come back to the cancer center. She's like, can we just do online appointments? And it was like, okay, tell me more. But like, to even have the courage to say like, I don't want to come in the cancer center. Most patients don't feel empowered enough to say things like that. Like they just keep doing what we tell them to. I also had a patient, talk to me about, this is someone with a lot of sort of autoimmune diseases and zebras, right? And feeling like interacting with the emergency room and the healthcare system was like being in an abusive relationship where you desperately need the care that the system is providing, and yet over and over people tell you you're faking something or don't believe you, or treat you in some way that doesn't help you on your journey and is harmful. And so I think being outside of the system, I've gotten to hear all of these things that nobody ever told me when I was a physician within the system
Mm.
about what their experience kind of going in and out of the medical system looks like. It's really sad.
I'll share a patient. I really value that perspective. I was referred to, so my surgery career ended after I was referred to, um, I might tear up, so I'm going to try to say this. I was referred to residential treatment for anorexia, and I got there and they couldn't keep me because my heart rate was too low. So then I went to a medical center that said, you need to go to an eating disorder center. And so no one could keep me. So I
Yeah.
went back to residency because no one could keep me. So I'm just gonna go back to what I know. And then a year later, I was still needing help. So I had accepted admission into my home institution's inpatient psychiatric unit. And I felt I went from being the person who was caring for patients to being the patient, and being in a locked unit where you can't go home. Your a lot of your dignity is stripped away. Like they watch you go to the bathroom, which is understandable for, for some individuals that need that, but ultimately that experience of my agency being stripped, and we know that as physicians, that with loss of agency is so traumatizing, that in 2021 I was critically ill again, and I refused. I survived it somehow, but I refused to go back into any care for an eating disorder because I don't see any that treat patients, particularly with anorexia. There's so much misconceptions around, like they don't want to get better, so you pretty much have to strip them of their autonomy and force feed them, which is not a compassionate approach or true for many, and many of us get worse after because of that traumatic experience. And what you said about just the invisible illness and people not being believed, they're being invalidated. And so then their health gets worse because they start wanting to avoid or being traumatized by the system that's supposed to help them. And that could be very uh very much in alignment with what maybe they faced developmentally. So it could be re-traumatizing of some experiences they had as kids. And for physicians in medicine, a lot of the people that I've met along the journey are they went into medicine because they were toxically shamed and told they were worthless. So they tried to find worthiness within being, a high achiever, and how much these systems then just perpetuate all of those traumas. And to have your awareness and your receptivity to hear that patient and be like, what is this? And how can I work to prevent being part of that re-traumatization and truly create a space for healing? It means a lot to me to hear that, and also to just value that we can call these issues out for what they are.
Yeah. Thank you for sharing your story. I'm so sorry that you've been through all of that.
Yeah, I
Yeah.
think, I mean, and it's help. I think it's helpful because now we can say, what are we going to do about it, right?
Yeah. Right.
Yeah, maybe
Right.
that's the privilege, is we get to be the ones that say, okay, we can be part of the solution here, and what do we want to do about it?
Yeah. Yeah. And I wish we could make bigger changes, right? But and I'm so grateful for the people that within the system are trying to make things better. And it's just not where I am most effective. It wasn't a place where I could be well to be all the time fighting, because the fighting is exhausting, right? It's depleting. And so I think we're at a place where the healthcare system is very broken in many ways, and it will be very interesting to see how it evolves in the future and what it looks like. And hopefully we can all create something better.
Mhm. I think the shift that you are creating is part of that big movement.
Yeah.
Because if we
Yeah.
keep trying to fix a system and it's so big that those micro changes aren't making movement, then that call to action that's creating something outside of it is that shifting of now people can see that, because there is a learned helplessness, this like blindedness of, if we don't see it modeled, we don't realize it's possible. So a lot of people feel stuck rather than saying, oh, wow, look what Dr. Miles just did. I wonder what I can glean from that.
Yeah. Yeah. And there's more and more people trying to create practices and do work outside of the system because it's hard to be well in the system. It really is.
And also with the, your palliative care background, I often think about palliative care being one of the only specialties that really gets taught how to talk to patients. And
Yeah.
that's a huge generalization. I know I'll probably get backlash, but you think about the people who are, because most times when people don't know how to fix things, and we think about so my specialty's head neck cancer. Sure, we can save the patient's life, but their quality of life and the side effects that really could improve with palliative care are off, they can be ignored, and they're now getting recognized. But just thinking about, it's not just survival, it's quality of life, and how these conversations can be had for individuals, like you said, that have chronic illness that are not just 6 months out from the end of their life. Can you share a little bit more about what drew you towards palliative care and also what you've learned from it?
What really drew me towards palliative care was sort of this quality of truth telling. I feel like when I was a hospitalist and I was watching things happen to people in the hospital, the often the physician understanding of an outcome was mismatched with patient hopes. And I really felt like what I wanted to be able to do was to have honest conversations with people about medical care and about what they wanted so that they could make the best decisions for them. And after doing palliative care fellowship, it really was hard, right? Because I do sometimes still miss hospital medicine and internal medicine and really digging into the medicine. But again, we're in a system where my intervention as a palliative care physician is primarily the conversation and that relationship again. It's me really listening to someone and hoping that I listen in a way that makes them feel seen and known at least a little bit so that they can ask questions and I can tell them to the best of my ability what sort of possible roads forward look like. And I think sometimes my own evolution in palliative care has been that often we think we know what someone should do as a physician, and over time, I've really settled more and more into it is not my life, it is not my journey. I have no, I know what I think is best, but it doesn't mean it's best for this person, right? And sometimes people choose things that I wouldn't choose, and I can understand that it's because of their own belief system or their own trauma or their own sort of unfinished business. And so that's what palliative care really is to me, is that getting to really deeply connect with someone and help them choose what's best for them. And I feel like my role is often as an interpreter, right? Like they meet with the oncologist and and they heard part of the conversation. They often, none of us hear the whole conversation because it's too much, right? And so then they've had time to process it a little bit, and so then we sit down and talk about what I know of the conversation and my impression of it. And I don't have another, I'm not trying to manage their cancer or their cirrhosis or their disease. And so I really get to be a more neutral confidant to help them understand and navigate. And being a palliative care physician has shaped my life, right? Like I wouldn't be doing what I am if I weren't talking to people about dying almost every day, especially working in the cancer center, to take care of people younger than I am who have died was like, what if I died next year, would I have wanted to spend my last year living like this? And the answer was no, because the work was incredibly meaningful, but I couldn't live my life outside of work. Like I was giving everything to work, and my life is much richer when I don't give everything to work, right? When there's some for me and there's some for my kids and my family, and I get to ride my horses and be outside and like really soak up this beautiful place that I live. So I'm incredibly grateful to the people I've gotten to take care of. Like it really has made my own life so much richer.
And I find it fascinating too. It's so beautiful that they were able to provide you with that gift of living intentionally while really acknowledging our mortality and this like fear of death that we have in Western culture. And even my own life-threatening illness, I didn't learn right away from that experience. I think I numbed and also sitting with that without a spiritual foundation. Like I was having a spiritual crisis and I knew I had deficits in that area of growth that made me more anxious and also avoidant because, we're supposed to know it all, right? As people that probably have really identified with being the ones that know stuff. I'm curious to hear, as you're talking with these patients, how have you grounded yourself to live intentionally and to honor that we're here for a limited time?
It's also an ever evolving journey. Um, and I will also say that when I was in training and when I worked as a hospitalist, I did not have a very strong spiritual belief or life. I feel like as my training got more focused in knowledge, like that part of my connection to the spiritual world got thinner. I don't even know if it was there at all. And it was really coming back to that has really enriched my life. Um, and that was through sort of meditation. And I did a program at the Upaya Zen Center called Being with Dying, and sort of connecting into the Buddhist community and teachings, and then the shamanic teachings has really given me a whole different connection and understanding of what about that is important to me. I think it would be very hard to do palliative care without a spiritual ground, because to me, I have to believe that there's some, that the soul has some sort of purpose for this journey, right? That this suffering and the pain and whatever is happening is a spiritual journey in some way. If it were just like physical journey, I don't think that, I think that would be hard for me. And so when there are horribly tragic and sad things that I work with or that I see, I feel like I'm able to offer it up to I don't know, and I hope that this is I trust or hope or believe that there's a spiritual journey that I'm not aware of in my interaction with this person. Um, I wanted to go back to the fear of death because we connected about that question online. And it's so hard. I feel like when I was younger, I actually wasn't afraid of dying, especially when I was a Peace Corps volunteer, and I was very, very sure that I was where I was meant to be. Like I was on my path on this journey. And and then when I once I had kids and I've been in this place of like I'm on this path, but is it my path? And it doesn't feel that fulfilling. Like I have a lot more death anxiety than I did before. And I feel like when I talk to people about death and dying, there's a lot of anxiety often about about the people they're leaving behind. And some people have fear of the dying process, like, will I suffer? Will that be painful? And there are some people who have some spiritual concerns about what happens after dying. But I feel like a lot of it is around who you're leaving behind and what's unfinished.
Yeah.
Um, and Frank Ostaseski, who is a teacher, and he was the founder of the Zen Hospice Project and has a beautiful book called The Five Invitations. But one of the things I heard him say, and I'm paraphrasing, but is like that we have the arrogance to think that we're going to do the spiritual work of a lifetime in those last couple of days before we die, right? And it's really my interpretation of that is like the work of making sure that we don't that our regrets are minimal. I don't think you can get rid of all of them necessarily, but that we've done what is meaningful and important to do, that we've said the things that matter, that we've been with the people that matter. Like I think we have to do that all the way through. Like my shamanic teacher says that our job in this life is to become a good ancestor, right? And it's that same idea that the spiritual work is all the way through our life in order to die well, if there's such a thing.
Yeah, there was a book. So when I was in medical school, we also my favorite rotation was integrative medicine, and there was a book about living a good death. So it's something of that nature, but it really called to that topic that I feel, just like you said, we need to talk about all the time
Yeah,
and normalize these discussions. And to reduce death anxiety, it's often what I hear is living your life to the fullest. And that's kind of what you're saying, is like focusing on what you'd leave behind, what you'd leave unfinished. And from what I've gleaned from following you everywhere is really that gift, like you mentioned, is okay, well, how can I make sure I'm living intentionally and supporting you in choosing to step away from a little bit more traditional path and create something that could feel a little bit more scary, but feels more aligned with what you really want to focus on.
yeah. And the word fullest, I'd be careful with because we have this tendency to think that that means doing everything. And I think it's about being like, it's about discernment, right? It's about what's really important. And there's an exercise of like, sort of imagining if I died in, 20 years, like what do I need to change now to make my life feel well lived or to make that death a good death? And then sort of counting backwards, like if I were going to die in 5 years, like what do I need to do now? If we're going to die in a year or if I were going to die in a month. And I think it just bringing so many of us, well, most of us have death far away. Like even if you have a prognosis of 6 months, people still have the tendency to push death far away. And I think if we can let it come close for a brief little bit, it's like a magnifying glass of like this is matters and all this other stuff doesn't,
Mhm.
right?
Mhm.
And it's so it's not about doing everything, it's about doing the things that are really meaningful and really like soul aligned. I
Mhm.
have the tendency to try to do everything and think that I can, but like I
Mhm.
constantly have to be like, I can't do all the things. I have to like what's really important, like what really keeps me alive and well and connected to myself.
Yeah, I really appreciate you calling attention to how that word can be utilized against us and really push us to kind of jump onto that hustle culture. Or I was actually just today listening to Tara Brock had I don't know if it's a partly meditation, partly conversation on overwhelm and how this constant gap about where we think we need to be and where we are that persists. We just sit in this constant state of, I need to be somewhere that I'm not. And that resonated a lot with me. And realizing like I had this conversation with my brother who's, very successful in finance. And after medicine and after all of the life changes, I've really like sold everything. When I thought I was going to die, I sold everything, a lot of things, most things. I bought some things back as I'm still here. But it was this freeing feeling of non-attachment to these material things. And the simplification, I like to say, we can maximize life by minimizing the noise and this like noise of worldly stuff that doesn't truly bring us happiness.
Yeah.
Because I know for me, when I was sitting in the hospital, I was just thinking about all the stuff I own is going to be a burden for people to have to like sort through.
Yeah.
And then of course, some of it I feel I could take it a little too far because I got a little apathetic. I'm like, screw it all. So there's like that happy medium of what you said, discernment for like what is adding value to your life right now, what is not, and then what do you want to do about that?
Yeah, yeah. It's easy to get overwhelmed. We're presented with so many opportunities. Um, it's both the stuff, right? But it's also all the things we sign ourselves up for.
Mm-hmm.
Even the like, wellness appointments and self-care stuff and coaching and like we can be totally overboard with all of that too, right? And it's like I was talking to someone last week who was like, I want to heal as many things as I can heal in the time I have left. And it was just like approaching healing as this like task, right? This
Yeah.
like I'm going to do all these things in this very masculine, task-oriented way. And I think
Mhm.
healing is much more of like the sacred feminine. It's much
Yes.
more of like receiving, of listening, of just that word discerning, of discerning when to do something, as opposed to like, I am gonna make this happen. Like
Wow.
we can't in my integrative medicine fellowship, the sleep person was Dr. Naiman from Arizona, and he said sleep is the one thing we can't make happen. It's like death, right? It happens to us. And it's such a fascinating thing to think about. But it's that like we can work on the conditions for healing, but we can't make healing happen either, with the exception of a surgery, perhaps. But like the
Mhm.
kind of inner healing that we're talking about is this flowing fluid process of listening and trying, but it's not a task. It's not something we can march forward.
Yeah, and even surgery is an insult before the healing, right? It's
Yeah.
actually an injury. And for well, using HPV for an example of when I was given the like, oh yeah, well, why does somebody, I'm a plant-based, I run all the time. my stress levels are super high. My immune system was crazy. You know, I had my white blood cell count was super low and I was malnourished. And thinking about forcing ourselves to heal is probably stressing ourselves out more and actually reducing our healing
Yeah.
capacity. It's so fascinating. And it's a lot of reclaiming and challenging the narratives of what we believed and then sitting, you know, a lot of mindfulness people are like, well, I'm not calmer, I'm feeling worse. I'm like, that's because it's the first time you've actually been with your thoughts and feelings. Like it's not meant to feel calmer and better. It's meant to be present with what is.
Yeah. And it's learning to do it in a way that's also non-judgmental, right? Because so many of us, myself included, approach learning mindfulness again with this critical voice and this like task-oriented, like I'm going to be a good meditator, right? Like, and it's that same thing of like learning to deepen into and allow as opposed to make happen.
Mhm. So what I'm hearing from this is taking all these shoulds and forces and kind of release them and open. You said divine feminine, more getting into that receptacle of I'm going to create a space such that I can nurture what may happen and trusting the body to be able to heal itself. Is that what I'm hearing, or how would you rephrase that?
Yeah, and it is, and the discernment piece is knowing when the task-oriented part needs to come in, right? Like there's certain steps we take to help heal or facilitate healing or facilitate moving our life forward. And so it really is this balance of the sacred feminine, divine masculine of listening and being and then knowing when doing is important. And so, but yeah, the shoulds are never helpful. We
Mm.
should throw all the shoulds away.
We should throw all the shoulds away.
Exactly.
I love that. I love the irony of that.
I know.
And when it comes to integrative medicine, so I know some people will have an idea of what to expect, some won't. So if we were thinking about coming to your practice, can you walk us through what kind of things would we expect?
First is I do have a pretty detailed questionnaire about life because I really believe that creating a life that allows us to meet our needs is a big part of the medicine. So there's like the container of our life, whether, you know, what we eat, whether we do eat, whether we eat regularly, whether we sleep, because many of us don't. What the quality of that sleep is, like, do we feel fulfilled? Are we super stressed out about our finances? What do our spaces look like, right? Because again, it's that container of does my space make me feel good, both because of the way it's set up, but also the people in it. And so thinking about sort of all of do I get outside? I think nature is super important and an amazing co-regulator, right? And so like thinking about all of those things. And then I really I take my lead off someone's story because as people tell their stories, you can hear where the hangups are, where the obstacles are, and people will tell you, whether they know they're telling you or not, they will tell you what's wrong and where they think they need to go. And then it's really about trying to support that. And I really believe you can't heal the physical body without doing sort of the inner work, the emotional, spiritual, kind of cognitive work, but they have to go together, right? And so it's partly lifestyle change of like, how do we get you sleeping or how do we shift your diet a little bit and how do we get you moving? Um, and maybe there are herbs that support you or supplements or other, you know, maybe an acupuncturist would be beneficial, but it's really, really starting to create this container where we can hone in more and more on what needs shifted over time to get someone in a better space.
So where can people find you if they want to connect with you more on that?
So my website is Healing with Intention IM for integrativemedicine.com. And then I'm on Instagram Healing with Intention IM or Facebook.
Very cool. Well, I follow you on those, so I will make sure to post
Thanks.
those
I'm,
links.
I'm launching a podcast soon. It'll be called Your Life is the Medicine.
Oh, that's
Sometime in the next
awesome.
month. Yeah.
Awesome. Congrats on
Yeah.
that. I'm looking
Thanks.
forward. When that comes out, I'll put that link in the description
Okay.
box too.
Perfect.
Yeah. And this has been such a beautiful conversation, and there's so many more avenues. And as you continue your journey, I'd love to catch up with you again.
Me too.
And for the audience, you've shared a lot of wisdom, but are there any last takeaways you want to provide the audience today?
It really is your life. Your life is the container. Your life is the medicine. And it's that Mary Oliver quote, like, what are you going to do with your one wild and precious life?
Mm.
How do we live? How do we live it? How do we live? How do we get out of survival and live? Yeah.
Yeah. Well, thank you so much, Sunny, for joining me today.
Thank you. It's been such a pleasure to finally connect. I'm
Yes.
so grateful.
Likewise. And for the audience, if you would like to share your reflections, your questions, your takeaways, we'd love to hear from you. Until next time, thanks for being here.
Thank you.